Hi everybody, this is nursing assessment of older adults, and I want to make sure that we do a brief assessment of older adults. We're going to practice a lot of these features later in the semester at the seminars, different smaller aspects of assessment and pieces, and we can really do quite a few different assessments as we assess our older adults. But because typically we have such a short amount of time in an office setting, I'm going to go over a brief 10-minute assessment. So when we do a geriatric assessment, we want to make sure that we focus on common syndromes and always be looking for signs of anything that's uncommon. Use principles of evidence-based practice, and anytime we can use things like mnemonics to help us remember, that is always beneficial. So the common syndromes that we see most often that impact older adults are listed on this slide. They are falls, confusion, incontinence, impaired homeostasis or fluid balance, and iatrogenic disorders. Another way to think about this type of screening is to use the mnemonic DEEP-N. The D would stand for dementia, depression, drugs, E's, ears and eyes, P, physical, performance, falls, psychosocial, I, incontinence, and N, nutrition. We'll go through each of those in turn here. So one of the things we can do for cognition is to use a test. There are several different kinds of tests we might use, and they each have benefits and downfalls. So this one's called the clock drawing test. It's a pretty handy test that you can do very quickly. You ask your participant to draw the hands of a clock. You have it. You can have the circle there. You don't have to. It's up to you. To score the clock drawing test, we use a pretty standard scoring system. We want to make sure that, first of all, if you break your clock into pie slices, it's going to help you to place which numbers are where they're supposed to be, right? So in A, if that's what they wrote, the score's definitely 0. In B, you can see that the number 1 is in the correct position, and 12, but really nothing else is. And so they would get a score of 1. In number C, numbers 1 and 2, 12, 1 and 2 are in the right position. They really don't count 12, so we're going by the 1, the 2, and when the number of numbers that are in the correct position is a score. So in D, you've got 7, 8, and 9, and 11 in the correct position. So that's a score of 4, and etc. But you're going to see, like I mentioned or showed you in this diagram, there's tons of variations that you're going to see between each of them. Basically, we're looking at, there's errors, there's no errors, how many errors, and how organized they are, or is there an attempt or any semblance of a clock at all. So here's some additional examples. The top upper left corner is perfect, and then we move through a score of 2, and then 3 as you move down that column, and then clear to the bottom right hand corner is a score of 6, because basically there's very little that you can distinguish in that one. Now, doing a clock drawing test actually requires more than just cognition, but it does give you a good idea of the cognitive abilities of your resident and how they've changed over time. Another assessment we want to really pay attention to is we want to make sure that we're not having any depression. Depression is easily overlooked with older adults, basically because signs of depression can mimic so many other things. And so it's important to kind of keep track of where your residents are as far as depression symptoms. It's also important to realize that you must pay attention to activities that the individual does, as well as just the scale. So they might score fine, no depression on the scale, but if they are totally isolating themselves and not visiting others or performing the activities that they normally do, then there still might be some signs of depression. This is the geriatric depression scale. Very quick 30 questions. Are you basically satisfied with your life? But then we also have some opposites. Do you feel your life is empty? As they score these yes or no, each of the areas with a 1 beside it is, if you circle no here in number 5, they get a score 1. But if you circle yes on number 1, they don't get a score. And then you just tally the numbers up at the total. Drugs are really important as well. You're going to see that we have a couple of different lectures that focus on medication and drugs, and we're also going to do an assignment that focuses on medications. So if a person is at takes 4 or more drugs, they're at high risk for drug interactions and adverse side effects. If they take any of the antidepressant, anti-anxiety, etc., any of the benzos, anything that's not prescribed, and then any alternative or complementary therapies. So it's important that you really question your residents. What medications do they take? What medications are over the counter? Do they take any herbal supplements? Use words that they might use instead of words that you would use to try to ask those questions, and ask it more than once. Whenever our residents have trouble with eyesight, they're going to have more trouble with their ability to care for themselves. And so we want to know if they have any difficulty driving at night, watching TV, problems with reading, or other activities related to vision. We also want to take a peek at their ears, and the whisper test is a real easy way to do that. Rub your fingers together near their ear, ask them about if they can hear it, and if they can't, then we need to send them to an audiologist to get checked. You can also check for earwax. Impacted earwax in older adults can be quite damaging to their hearing and make it very difficult for individuals to understand speech. If you're worried about that, you can either refer them to an ENT physician, or you can do some ear irrigations to help remove any wax that might be there. You should not insert anything into the ear canal to remove any object that might be there, or wax. Irrigation is the only thing that a nurse should do with residents. If you think something needs to be removed, then refer them to the ENT physician. We also have a test for physical performance. This is a tug test, or a time to get up and go test. This is when a person, we time the amount of time it takes a person to rise from a chair, walk 10 feet or 10 meters, turn around, and then come back. Again, this tests more than physical performance. It takes a lot of executive skills and cognition skills in order to perform this test. And it's a really quick way to see how their overall functioning is. Typically, we do the tug test maybe once a year at the physician's office, and so it's not something that gets done frequently, but it is a really nice way to do a quick assessment. If the tug test is seconds are too high, so over 12 seconds, and then typically you'll see that they have deficiencies in mobility, cognition, or executive functioning. The SF-12 measures physical and mental health. It's really a composite score from 0 to 100 and needs to be interpreted based on the patient's age and other disabilities. I just put part of the questions here just so you could kind of get an idea. So you would say the first question, how would you say your health is? And you would circle excellent, very good, good, fair, etc. On a typical day, does your health limit you in these activities like climbing several flights of stairs? And each number next to what they answer is the score, and you total it at the end. Instrumental activities of daily living, or IADLs, these really show executive functioning. More than activities of daily living, instrumental activities of daily living deal with things like ability to manage finances, find their way around or wayfinding, ability to write checks, make phone calls, cook food, those types of things. The score can range from 0 to 8, and a lower score shows that the person has more functional limitations or a higher level of dependence. This is that scale, the IADL scale, and you can see the ability to use the phone, shopping, food preparation, and then we tally that score up as well. We also need to pay attention to falls. Not only how many times have they fallen recently, but do they use any medical equipment or assistive technology to help? How's the environment? Do they use alcohol? Do they have signs of orthostatic hypotension or any local or diffuse weakness? Asking about incontinence is important, and how frequently that occurs. So in the last month, have you lost urine on at least 6 separate days? They may not know that question the first time it gets asked, and so you might ask them to track it, how often they do lose their urine, and that can be helpful to determine as well their ability to maintain their functional independence. The more frequently they lose their urine, the harder it is, because they'll rush to go to the bathroom and or may need to wear additional Depends or something to help keep them dry, and that increases their risk. And in nutrition screening, we need to pay attention to weight as well, and if a resident has lost 10 pounds in 6 months, they're at high risk for problems. So that's the end of this mini lecture. Please let me know if you have questions.